workers' associations, civil society organizations, patient advocates, youth representatives, and community health volunteers have all validated the People's Health Manifesto. This manifesto is geared towards a healthy nation dubbed Afya Nation. This manifesto calls on all political parties and aspirants to adopt the following 5 policy priorities as they seek national and county offices in the upcoming 2022 general election. Number 1, to reinvigorate preventive health through community and public health policies by ensuring 1 community health worker is employed for every 50 households and 1 doctor for every 1,000 patients. Number 2, to guarantee universal health care by increasing investments in the national and county public health care facilities by 15% and 50% overall budget, respectively, and ensuring that at least 85% of NHIF is spent on public health care. This also will ensure that in every county there is a level 5 hospital, and overall in the country we have at least 7 level 6 hospitals, which currently we have only 2, and that every ward should have at least level 4 hospital, so that every Kenyan is able to access health care. Number 3, to deregister any institution denying emergency treatment and diagnostic and ensure that at least 85% refund of cost incurred in supporting emergency treatment. Number 4, to tighten laws and strengthen investigative and prosecutorial actions to convict thieves of public money and ensure recovery of all proceeds of corruptions in the health sector, with interest and reinvest these proceeds in the public health care. This will ensure that at least all those who get into the office should make sure that this is done the first year of being in the office. And number 5, to dedicate funds for annual recruitment of all cadres of healthcare workers to meet WHO recommendation. This should be similar to what is done in the security sector, where every year we have the police being recruited and the armed forces being recruited. Healthcare should not be left aside.
Thank you very much, Dr. Davji. I'll continue. My name is Irongo Houghton, and I serve as the Executive Director of Amnesty International Kenya. This manifesto is the product of extensive consultations with patients, consumers, and providers of public health care services in 9 counties, namely Kakamega, Kajiado, Kisumu, Kilifi, Kiambu, Garissa, Nairobi, Tana River, and Uasin Gishu. As we build back from COVID-19, these 5 priorities must be placed squarely in the manifestos of all political parties and all political aspirants in the upcoming general elections. If there is one thing that we must learn from COVID-19, it is that healthy living habits, adequate investment in health workers, and health infrastructure is critical for disease prevention. The government of Kenya struggled to create a suitable, comprehensive response to COVID-19 and the pandemic, despite painful lessons during the HIV/AIDS epidemic. We must stop grossly underfunding and continuously deprioritizing public health. Allocating less than 6% to the national budget annually drives a broken healthcare system. It encourages and drives medical catastrophes across Kenyan families. It violates the constitutional principle of the right to health. And lastly, it violates Kenya's obligation to invest 15% in healthcare under the Abuja Declaration. Despite numerous public resources invested in training doctors, Kenyans seeking healthcare in health facilities are unable to enjoy the quality healthcare services that they expect. As a result, there is a massive unemployment of highly skilled medical professionals. This manifesto marks the beginning of a public demand for all political parties and political aspirants to prioritize the right to health and affordable, accessible, available, and quality healthcare for all Kenyans. We are now calling on Kenyans to study these 5 priorities, to share them with all the aspirants that come before you this year. Do not let our rallies, do not let our political rallies become concerts and stand-up comedy. Make sure that your aspirants speak to the issue of the right to health. Demand that they discuss these issues, these priorities, and that they integrate them in the manifestos of all political parties and aspirants. Signed, Dr. Davji Atela, KMPDU, and Irungo Houghton, Amnesty International, Kenya Executive Director. Thank you very much, and let us invite questions and comments, some of which the two of us, Dr. Davji and myself, can respond to, but of course we have a number of people here who maybe want to respond to some of the questions. Very good.
And just to summarize what has been said here, this manifesto is going to form part and parcel of whatever any political leader is going to be out there with. As KMPDU, as Amnesty International, and all other stakeholders who are here, we will try to check that are these just rhetorics that different leaders are coming up with, or do they really want to change the healthcare in the country? So we'll be out for that, and we will rally out our people in different ways. We are not a political organization. Personally, I am not a politician, neither am I a student of politics, but I'm a believer in ideologies that will ensure that what we stand for as institutions ensures that there's health care for all Kenyans, and the doctors, the nurses, the clinical officers in all facilities. That's what we are reading today. Thank you.
Viva Kenya, viva!
Viva.
Afya Nation, health first.
Thank you very much.